Medical professionals of Reddit, have you ever had a patient so lacking in common sense you wondered how they made it this far? If so, what is your story?
Plenty, although the one that always sticks in my mind is a patient I met during my early years on a palliative care ward suffering from terminal cancer. She was only in her early 30s, and the only reason she had gotten so far gone was that she had relied on the healing power of crystals rather you.
Former practicing surgeon. Male came in with a small bowling pin up his backside, for the third time.
Had a patient come in for burns because he smoked while wearing his the same.
I feel this. Had a patient who we helped get access to home oxygen privately because his respiratory specialist wouldn't sign off on it because he wouldn't quit smoking. Patient was very indignant about it because he insisted that he had totally quit smoking for realsies and hadn't smoked for 4 months. Got a call from a nurse in emergency a few weeks after letting me know had come in with burns under similar circumstances.
Okay, so not a medical professional, but hear me out for a second. I work in a gym and recently had a client come in for an induction, basically walk through the gym, design program based on goals, needs, and physical capacity. The client, in her late 70s, has a shoulder injury, which the physiotherapist has said, the rotator cuff is barely. Client has been suffering in severe pain for years and hasn't been able to use that shoulder, and refuses to go to the doctor as she doesn't want to see a surgeon, doesn't want surgery. I've echoed what the physiotherapist has said and have refused to do any upper body exercises because of how bad the injury is. The client would rather live in severe pain than seek necessary medical treatment and only takes pain relief medication when the pain is intolerable.
I overheard a conversation between a nurse and a doctor and a patient in the ward trying to figure out if he was very or has a head injury. It was both hilarious and kept telling them that he was there for a hurt leg. He couldn't explain why his leg was hurt, how it was hurt, how he got there. Nearly anything. I heard them taking in a hallway to each other. The nurse was convinced he hit his head. The doctor said, "No, he is just an idiot." Turns out the doctor was right. They go a hold of the guy's wife. She basically told them in the hallway he is always this dumb and if she leaves him he would get lost in his own house, and it sounded like his leg was visibly injured or swollen. But when asked what happened or how does it feel, he gave nonsensical idiot answers. Not like slurring, but in a regular idiot "It feels hurt. I was talking to Jimmy and we were doing our usual work and my leg hurt. Doc, did something happen? What is the work? Something always happens. You know how it goes. I just want my leg fixed."
Just yesterday a child patient needed a blood transfusion. The mother was apprehensive because they thought their kid could be vaccinated through the transfusion.
Go see patient in labor. Explain through the whole risks, benefits and process of a labor epidural. Finish up procedure and have just secured the epidural catheter to the skin. Husband asks, how is she supposed to through that small a catheter?
Saw a similar story, but worse because it was a child with cancer and parents who were convinced some vitamins would help, so basically the child just suffered and went on palliative. Admittedly, with chemo, survival rate was about 20%, but I still can't get over that they didn't even try because their vitamins would do everything.
How does someone that dumb get a wife that's seemingly not as dumb?
My aunt. She was diagnosed with cancer. Instead of getting treatment, she went hardcore vegan and prayed. Refused to use any med. Doctor said she could have made it for few more years. She died after 6 months.
When I was in the hospital as a patient, there was this one guy in ER who really wanted to step outside to smoke. The nurses pretty much belted him on the table and yelled at him that he had complete kidney failure and they need to treat him immediately or he will die in the next 20 minutes. To their dismay, he didn't listen and tried to vehemently free himself and go outside and smoke. He was in his 30s. It is a mystery to me how this guy survived that long.
I'm a vet. A few years ago I had a client bring his young cat in complaining of lethargy. Besides being a bit underweight, the physical exam was unremarkable, so I asked more questions about the cat's diet. Me. What do you feed the cat? Owner. Online trendy raw food brand. Me. How is his appetite? Does he finish what you feed him? Owner. Yes, he always eats. How much do you feed him? Owner. 1/2 once or twice daily. Owner. Once every 3 or 4. You only feed your cat twice a week? Owner. I believe in a more natural feeding approach, and based on my research that's how often cats eat in the wild. This owner was slowly starving his cat to death. Based on some cockamamie idea he'd made up watching National Geographic, I had to explain to him that domestic cats are not tigers, and that small wild cats eat 10 to 20 small meals daily. Surprise surprise, the cat's lethargy and weight improved with regular feeding.
My dad went the whole chemo route. As he lay dying 3 years later, he told me he should have just let his body go without the chemo. His last 3 years were absolute torture.
Optometrist here. If I had a nickel for every time someone said they use for eye drops I would have, which is not a lot, but it's weird that it happened twice.
Big deck in the garden.
I worked EMS for years. It never ceased to amaze me the things people will do to themselves or others for fun. Confronted with these types, my first question was always, at what point did this seem like a good idea? The weirdest one I can remember was a guy that put his through a large metal nut. Once he got he couldn't get it off.
The old 3-strike policy.
Once is weird enough, but twice? What the, wouldn't that sting?
So, you're lactose intolerant? Yes, and you knew this before? Yes, and you drank a milkshake? Yes. What size? Large. The rest of the night was the kids screaming and groaning in the ed waiting room.
Thank there's a happy ending.
Nurse here. Had a patient with a tibial plateau fracture that demanded to see the doctor because she wanted to quit her antithrombotic medication. Bad idea. According to her, it gave her a dry mouth. I explained to her that it was no known side effect of that drug. This lady had type 2 diabetes and administered her own insulin. Dry mouth is a side effect of high blood sugar. Tested her blood sugar, it was 2. Turns out she was using the same needle twice. Edit. These particular needles are single use, so she only got half the dose.
Just had a man die to this. Had burned down his home the day prior and then proceeded to burn down his friend's home and die. Thankfully the friend survived.
Sadly, I once went to the with my mom. It was a minor thing, we good. And there was this old lady that asked my mom, "How long have you been waiting for?" "I'm only here for my nails and hair, it should be quick." My mom replied that it shouldn't take long, but I could see her holding up tears. Since this old lady was alone and confused and she couldn't even understand where she was. We talked with a nurse and someone helped her, but it was pretty sad to watch.
I'm in the so many stories. The one that left me dumbfounded was a woman was brought in by her sister for pelvic cramps, amenorrhea for 3 months. Lo and behold, she's pregnant. Sister informs me that she sleeps with the Brazilian construction workers building the condo complex next. Ask if they have any questions. The patient asked me if her baby would come out speaking Spanish. After a long pause, and her sister staring at the ceiling, I told her, no, because they speak Portuguese in Brazil. Patient seemed relieved and the sister hustled her out of the before I could discharge her.
I work in clinical research at a hospital. Basically, for patients who have cancer and don't have other standard of care options, clinical trials, experimental treatment, are a viable option for many. Some people have a negative view of research, but it's highly regulated and not as scary as it sounds. We go through the consent form with this patient, who has a history of drug abuse. We don't know everything about this new medication, but one thing we do know, is that using cocaine while taking this drug will make your heart explode, in layman's terms. This patient promises they're off the sauce and that they totally won't do cocaine while they're on the trial. 2 weeks later they relapse and, well, you can figure out the rest of the story.
At least he's an idiot willing to learn.
M's checking in. Late 20s male called 911 for a mild headache. No alarming symptoms. Middle of allergy season. Being good medics, we check all the things. Totally normal vitals. No fever. No medical history. Just a mild headache that started about 30 minutes prior. Do he take Tylenol or ibuprofen or anything? Nope. He wanted to go to the to let the doctors handle the